Hello, and welcome to the fourth episode of the Movement Prescription podcast. I'm Callum, and I'm your host for today. I'm a GP trainee at Aberfeldy and a researcher at the University of Dundee, and I'm passionate about physical activity. I'm pretty early in my career and I've got a lot to learn, but I hope through this podcast I can share some of that learning with you. The aim of the podcast is to provide some CPD for primary care staff around physical activity, to inspire staff to take up physical activity themselves, promote it to patients, to educate listeners about the latest knowledge, and then also to transform primary care. Today, I'll be interviewing Dr. Rob Lawson. Rob qualified in 1975 and has combined working as a GP in East Lothian, near Edinburgh, with his passion for lifestyle medicine. In 1991, he founded a charity, ELCRG. Rob, I'll have to get you to see what the acronym stands for, which provides weekly activity for people suffering with long-term conditions. And in 2016, he founded the BSLM, which is the British Society of Lifestyle Medicine, the European Society of Lifestyle Medicine, and the World Lifestyle Medicine Organisation. Although no longer working clinically, he's not so much retired as reinvented. He's got this huge list of accolades, which I think it would take most of the podcast to go through. So I just implore you, if you want to know more, to go and check him out on LinkedIn. Hi, Rob. Thanks for joining us.
Hello, Callum. Well, that's a lovely introduction. Thank you very much indeed. It's lovely to be here and a very, very important topic. And of course, I know how passionate you are about it.
Well, I thought, if you don't mind, we could start with some rapid fire questions just to get us started. The first is hopefully an easy one to answer, or maybe not. What's the most influential book you've read?
Yeah, the shortest questions are the most difficult ones to answer. There's not much wriggle room. And of course, my answer to that really is, it depends on my time in life. But I think that what I've chosen, because you gave me advance warning of this, is a book called Deadly Medicines and Organized Crime by Peter Goethe, who's a founder of the Cochrane collaboration. And it goes on, the title is How Big Pharma Has Corrupted Healthcare. And when I read it, sadly, at the end of my career, in terms of NHS practice anyway, I was squirming in my seat and I actually felt slightly ashamed that I'd been prescribing the way I'd been prescribing for so long, especially when I believed I was doing good. So that's quick fire. That's my quick fire answer.
Thank you. And the next one, I'm also sure you're glad you had some forewarning about. What is your best habit?
Again, that depends on where you are in your lifespan. And now in late middle age, according to my wife, I had to ask her, it's moderation. So I don't overdo things, one end of the scale or the other. And of course, that fits very well with my work with the traditional lifestyle Mediterranean work. So for moderation in all things is an interesting mantra. So I would say that's probably the best habit.
Well, that's a great answer. I'm going to ask you to just briefly expand on that, because one thing I think we can often neglect is moderation in excesses, or moderation of excesses is really important, but sometimes we can excess in things we perceive to be good. And I think some of the people listening to this will have a kind of an addiction to exercise like me, and I think moderation in exercise is important too. Is that something that you strive towards?
Absolutely. I think in the traditional Mediterranean lifestyle, apart from ancient Greece where they had the Olympics, most people just simply got their activity through daily life. So I think that, and also moderation is not a quantitative term, is it? So you can argue, well, your moderation is different from my moderation. But the reality is actually most people understand it. They know, they seem to know when so they need to moderate a bit on the activities they do. As far as physical activity, Callum, I know you're into it, and I've got a family who are into it. But I've long argued that you can overdo it, and so I think that, yeah, I recommend my family from refraining from doing too many marathons.
And the final question, this is, or the final rapid fire question. What one thing would you wish you'd known as a GP trainee when you set out on your career?
I think that I would recommend that to get it into your head that it's actually okay to keep asking why. Asking why, both of oneself, but importantly, to others. And it was one of the things that lots of trainees came through my hands. And that was the one thing I would really encourage them to do. Just why? Why am I doing this? Why am I being asked to do this? Always be curious, always ask why, and trying to find the answer. So that would be my quick fire answer.
I wanted to ask you a question, Rob, about shifting culture, particularly regarding sedentary behaviour. And I think as an enthusiast and suffering from pathological enthusiasm, I often can almost present physical activity as this new cure, but I think for thousands of years we've known it's good for us. And when we talk about shifting culture, I think it's almost a shift back, isn't it, as opposed to a new shifting culture. Sadly, and I shared an infographic with you, which I'll maybe put up on the resources of the podcast afterwards, about the fact that there's been no shift in sedentary behaviour or increase in physical activity in the UK over the last 10 years. I'm wondering, do you think it's possible? And how do we set about doing that?
Yes, it is possible.
I'm glad you said that. Otherwise, we'd have to stop the podcast.
I think that we can continue to make the start that people like yourselves are making. I think it should be done in schools, in my view. I think that there was a time when in schools physical activity was the norm, and now it isn't. I think there was famously a teacher strike many years ago, and teachers were giving their time freely to keep children active and get involved in sports and so on. And that fell apart. So schools is important, yes. In the tertiary learning environments, med schools, nursing schools, all these sort of, it just needs to be throughout the life course, really. BSLM obviously is doing its bit through its learning academy, but generally working on the sort of lived environment. We have to have safe and accessible areas where people can enjoy being active, and it has to be easy for people to do. One of the things that irritates me actually is in hotels, and I've had to do a lot of traveling, is trying to find the stairs. You're shown to the lifts. You have to really look for the stairs, and when you do find them, they're usually sort of escape hatches, not very well lit. But that's an example of why the lived environment, if you like, matters so much. I always remember, stop me when I'm rambling, but I always remember Mike Lean. I don't know if you've heard of him, but anyway, Professor Mike, he once in one of the hospitals in Glasgow, he put a sign up on the lift saying out of order. There's nothing wrong with it, but he put a sign up saying out of order, an arrow pointing to the stairs. So people in hospital have to use the stairs. And I'm thinking, good on you. I think that's, we've got to get that message across. At a conference in Orlando, a lifestyle medicine conference, the only one I've been to in the States, actually. The venues in America are amazing. And they had the stairs up the middle and then moving stairs on both sides. And I just observed, thinking, surely in a lifestyle medicine conference, people would use the stairs. No, not a bit of it. They're all standing on the moving stairs. So I think that, I think that we've got a lot to do. I imagine even in large villages or small towns like Aberfeldy, Callum.
Yeah, I think that resonates a lot. There's a couple of things there. One, I was recently at Euston Square with the RCGP, and they had to give me an extra pass to use the stairs.
Exactly.
They were really surprised when I said I don't want the pass for the lift. And I think I explained to you earlier, and for the listeners, I'm currently out in Copenhagen doing some work out here, and the environment here is set up for cycling and for movement. The cycle lanes particularly are brilliant. Just moving on, Rob, there's two main topics I hope to cover today. One is advocacy on a patient-by-patient basis in consultation. And the second is community and group-based action. To start, over your career initially in primary care, over your career, how did you advocate for physical activity and lifestyle medicine as a whole to your patients?
The thing that I come up with really is that as individuals in the healthcare industry, we have to be reasonably good examples. I think role modeling, actually does make a big difference, especially in the old-fashioned way of general practice of, being a partner and being established in a community. So in my case, I stupidly, well, not stupidly at all, but I ran a half marathon. I couldn't bring myself to run a marathon, but I ran a half marathon to raise money for the local, we're building a new health centre. And so to equip it, I just ran. Yeah, and that sort of raises awareness. So I think that role modeling and awareness raising in any forum, in any community. I organised a family well-being day, for example. I know today's, of course, you've got Parkrun and Walk the Dock initiatives, which are great. Then, of course, introduction within the practice, I introduced a sort of fitness testing, prehab fitness testing within my practice, a way long time ago.
Was that for patients or staff? Staff didn't have to get a certain level on the beat test to...
There's anybody that would be anybody that wanted it.
Okay.
Of course, you had to make time for it, of course. But I moved on then to what I called the LAMP Clinic, Lifestyle Active Management Program. And that was focused mainly on people with chronic disease or people living with chronic disease. And at that time, of course, that was pre-computer time. Although it did well, it came to a kind of full stop at a certain point. That there's a limit to how much could be absorbed within the practice because it was thought to be time-consuming. And in those days, although I was doing group consultations in another forum, it never occurred to me that we could maybe do it in the practice. So there are lots of ways, I think, that, at an individual level, you can make the difference. And I think the combination of role modeling and raising awareness and making practical steps within your practice are the way to go.
Could you talk us just a little bit through the lifestyle active management program that you set up? What did that involve and what did it look like?
Well, it was everything that you'd expect in lifestyle medicine, but it was before lifestyle medicine was invented. So we couldn't call it that. The only thing missing from it actually was sleep. At that stage, I knew nothing about it and didn't appreciate its importance. But everything else asked the question. There were questionnaires, and it was mainly our nurse, in fact, who was as trained as we could be. We didn't have formal training to raise these issues with her people living with chronic disease, and it's amazing. Just simply asking the question was often enough. That was a brief enough intervention, if you like, for people to stop and think. And they'd never been asked that before, so it was a novelty for them. But there again, I come back to it. I would have been much more effective in a group clinic, in a group consultation model. But it was, I remember painfully typing everything out and getting all the activities that they couldn't do, and how they could giving information and helping people give up smoking, and even how fast to swim, how fast to walk, how fast to how long to spend on your bike, and it was very detailed, but it was supposed to be very personalized. So, and satisfying as it was, I think that it wasn't sustainable for one reason or another, and I had to stop it.
Two things I'll pick up on there. One is the importance of personalized advice. I think that's coming clearer and clearer, isn't it? And the need to make it, I think we call it SMART goals, isn't it? Specific, measurable, achievable, realistic, and timely.
Yeah.
The other thing, I think if listeners don't know about lifestyle medicine, I think there's 6 pillars. You'll have to correct me if I get them wrong. There's physical activity, eating real food or diet, mental well-being, avoiding harmful substances, sleep. I've forgotten the last one. I'm so sorry.
Healthy relationships. Healthy relationships, social connectedness, purpose in life. That's actually, it's one of the most important ones. In fact, the most important one in my view.
There's one thing that I actually was working on yesterday that stood out from what you said, and there's a report that we've been writing through here with the World Health Organization, which talks about combining lifestyle advice and things that go well together. And the paper that has been written and I was reading was really interesting because it talks about physical activity and diet naturally pair really well together. And they're two things that actually, by providing them together, it enhances the outcome of both. But smoking with physical activity or diet, often the agendas are slightly different, and the paper from the research was suggesting that smoking is something that needs dedicated time separately from other elements. I don't know if that's something you've experienced yourself, but it was interesting from what you're saying about the kind of combined approach.
I think that when you're practicing lifestyle medicine, you quickly realize that when you concentrate using SMART goals and coaching methods, that if you are listening to your patient and doing what matters to your patient, you may decide to fix on an easy SMART goal. But what they realize soon and what you realize soon is that the impact it has on the other pillars or domains of lifestyle medicine. And as soon as that happens, of course, the penny begins to drop. Actually, just simply concentrating on the one is a great start, but it's not going to be the sole answer. So I think that they do go together. I think this reminded me actually of, it was Stephen Blair. He did a paper back in 2009 called Physical Inactivity, the Biggest Public Health Problem of the 21st Century. That was the importance of cardiorespiratory fitness in the population that he was looking at. It had more effect in terms of reducing mortality than obesity, smoking, and diabetes combined. I think that is such a powerful message, which I keep on repeating in the hope someone listens. That was back in 2009. And then thinking back maybe a little bit further, 2002, there was an article, a publication looking at physical activity and I think diet as well, from memory. And it was about preventing type 2 diabetes anyway. And the conclusion was that comparing lifestyle interventions, and I think it was physical activity and diet, versus metformin in diabetes prevention, that it was 56% versus 31%. For metformin was less good than physical activity and other lifestyle. Now, the frustration there is that was 2002, and yet the focus was on the drug. Yeah, the drug is really successful. Well, what about the other thing? Which is even more successful. So there are frustrations along the way.
I think sadly, I've noticed that with the sumagliptin that's all over the papers at the moment as a great way of losing weight, and sadly overlooking the lifestyle factors we can play and the implications of taking a medication. And maybe we've not learned very much over the last 21 years.
No, it's an interesting one because it is running into supply problems, I understand. And now I'm sure I heard somewhere that it's also causing suicidal thoughts or something. But I think the official lifestyle medicine position on that may well be that it's useful as an adjunct. And I'm not keen on pharmaceutical interventions if you can help it, but I think some people are in such a place, that I can see that there is a place for it, but not to have a supply to people that need it because of, I don't know, celebrities taking it. I mean, that seems all wrong to me.
Thanks for clarifying that. I think that's a really important point, that there's a place for these things, but lifestyle medicine is really important as well. One thing you mentioned at the very start was role modelling. And you gave some great examples, including running a half marathon, organising a wellbeing day. I'm wondering, did you role model in your office space or in your consulting room? Were there things that you did in the space to prompt questions or provoke conversations?
Yeah, that's a good one. I think that the staff get to know you. You don't need to, they know I wasn't a smoker, I stayed active, and I used to get up and walk and bring patients into my consulting room rather than sit and call. So they knew that. I tried to introduce some initiatives, but I didn't want to push too far. Because the thing is that one of the things that you'll know, that patients come in, grateful patients come in and give to reception staff a whole bunch of chocolates and biscuits and God knows what. I'll tell you something funny, actually, because we, as a group, we had 3 practices in one building, and I remember having to persuade them to actually accept computers into the building. But anyway, one of the topics that came up, which caused a slight furore, was the type of biscuits that we had available. And the question was whether you had a biscuit with chocolate on it, digestive biscuit with chocolate on it or not. You can imagine a group of doctors sitting around deciding. And of course, they eventually decided they would remove the chocolates and keep the biscuit. So in my practice, it'd be lovely to have had, the opportunity. We put fruit into their room, and they were invited to help themselves and all that sort of stuff. But there wasn't a huge movement to try and influence people in that way. I think that the best example in any community is a local champion. I think that if you've got somebody, even if it's in the community of reception staff, if somebody has done something that makes them feel great and they look great and they're acting great, the others saying, well, what are they on? What are they doing? That's the best advocate, not from the doctor or the nurse, but from somebody else like them who has made a difference. And I've always felt very strongly that local champions can make the difference.
Oh, great. Yeah, that's really interesting. And I think often, reception staff and admin staff live and work in the community and are recognisable faces, or particularly in rural communities like I work. The lead into the question I asked was, I'm inspired by Susie Scarlett. She does, and I'm sure she'll maybe share in some other episodes, but she does some amazing things with her workspace, and she always leaves her standing desk up. I've started doing it in consultation, and the number of times that patients say, oh, why are you doing that? Or what's that about? And I try and leave my helmet on a hook as well in the room. So, and there's been a few conversations from that. So it's really easy prompts.
Yeah, well, that reminds me of a story about Zoe Williams, who's one of our directors. And I may have got this wrong, and I'm sorry, Zoe, if you hear this, but my understanding is that whether it was her or one of our friends that was a GP, used to put their cycling helmet on the desk, so everybody could see the cycling helmet. So she wasn't cycling anywhere in London, but she had the cycling helmet there. So the message we get across, that activity, cycling is a good thing. So I think, yes, there's some sort of subliminal messages are important.
Thank you. And moving on to a more community group-based action, and you've already mentioned the Lifestyle Active Management Programme. But in 1991, you founded the ELCRG. What does it stand for, Rob? Or what did it stand for? And now it's Live Well East Lothian.
Yeah, I think Live Well East Lothian is a better. It was called the East Lothian Cardiopulmonary Rehab Group. So that was the way it was registered with the charities regulator, because it started out as purely cardiac rehab. So what led me to it? Well, I think I understood quite early on the power of healing in terms of physical activity. And my practice was more than 20 miles away from Edinburgh, where there was, in fact, a rehab facility for people post-MI. But what I've discovered is that they didn't want to travel. My patient didn't want to travel there. So there was not a natural gap. Post-MI rehab was the entry point, therefore, for the charity at that point. And it grew. I couldn't do it within my practice. I had to form a charity outside my practice to deliver on it. There just simply wasn't time within the practice. It grew into prehab, then other chronic conditions with which locals were living, and then moved into primary prevention with a falls prevention program. And crucially about, what was important to me was that there wasn't a start and finish point. Any cardiac rehab programs, there was a start and finish point. And I was convinced that that wasn't the way to go, that you had to have it there and people knew they could clock in forever if that's what they wanted. And that's the facility that we tried to create. So in order to do that, we went through the 12-week program at the start and then had a phase 4, what we called phase 4, where they could come and join in groups which were either self-led, but I felt strongly it should be professionally led. And so we had trained people delivering groups. So we got something like 17 classes around the county every week. This is now, of course, turned into Live Well East Lothian and is under the wing of the British Society of Lifestyle Medicine too. So we wanted to become the sort of operational public-facing template or blueprint, which might be suitable for other regions in the country too.
I suppose it leads on to my next question. If people want to do something similar, presumably there's an easy way for them to find out, and it would be Google Live Well East Lothian and find out the policy and the programme and what you're doing there. I suppose as someone that's early on and learning from everything I do in medicine and beyond, what did you learn from the process? And what advice would you give to someone anywhere in the UK that identifies an issue like you did and wants to seek change?
I think that the lessons were mainly painful. Just how hard and frustrating it is to raise funds. How strapped the NHS says it was and the local government said it was. They were never able to help us out. And how lonely it can be. But on the plus side, the users always gave me, anyway, the inspiration to persevere. So a visit to any of those 17 classes, if ever I felt a bit low, that's where I'd go. And it was hugely humbling and rewarding and inspirational to see all these happy faces, people who thought they wouldn't survive. And some people have been coming for over 20 years. So I think that my advice generally, follow your passion, maintain your self-belief, maintain your skill sets and use them to the maximum effect. Just do it. So I think it's a lot easier probably in my day than it is now. But those are the qualities I think that will make it successful.
Sounds like perseverance plays a huge part as well.
Yeah, and perspiration.
Great. Thanks, Rob. A lot of what I wanted to do from this podcast was just basically talk to people that have inspired me, and I'll hopefully add some bits in from Hussein and Susie in due course, and the advocacy that all three of you do. But there's 3 questions that I kind of want to finish with, Rob, if that's okay. The first is, what thing, or things plural, have you done that have had the biggest impact?
I think that it's difficult, isn't it? Because I look back over my career thinking, what difference did I make? I eventually decided that actually it was the connection that mattered, not necessarily what I did. But at individual level, I think the stories that emerged from individuals within the Live Well experience, that was hugely impactful on me in terms of being rewarding. At BSLM, similarly, actually, the case studies from when we were doing the diploma, the international diploma, the case studies were hugely inspirational. I think that what you guys were doing, absolutely amazing. And so BSLM, I think, has been having an impact, and that's good. So I would say, the gold standard qualification in lifestyle medicine in Britain through the Learning Academy, that has to be one of the impacts, I think.
Yeah, great. And I can vouch for the fact that BSLM is having an impact, or it certainly has on me. I like the touch on the individual level with patients as well, and the importance of promoting lifestyle and seeing the benefits of that in patients as well. It's hugely rewarding. Next question. All journeys start with small steps. What steps or what first step do you recommend to others who wish to get started in using lifestyle medicine and physical activity in their careers as primary care practitioners?
It's quite simple. Just do it. I think that, be that person dancing on the hillside and look out for anyone willing to join in, and warmly draw them in, and support and spread your passion. So that's my advice. Just do it.
I suppose it works in two forms, Rob. Is that just do it as in get active yourself and get out there, or just do it and recommend it to patients as they come in the door?
Both.
Or a combination of the two?
Both. I think it has to. You have to be consistent, not only at individual level, but in your private and professional life. I think it's difficult to separate the two. And as I said, it gets back to role modeling, I suppose, doesn't it?
Yeah. Interestingly, the biggest predictor of a doctor advocating or promoting physical activity is their own level of physical activity.
Yeah, exactly.
And so if you address your own, you're much more likely to recommend it, which makes sense.
Yeah, exactly. And I think that you're more likely to be believed as well. I think that if you've got a doctor who smokes and he's telling his patient to stop smoking, and the patient knows full well that he goes round the back and has a cigarette, it's not going to land on very fertile ground. So I think that, you need to be able to be credible. Yeah.
The final question was, you, Hussein and Susie inspire me, but who are your role models? Who can we look to also emulate?
Well, I could come up with, I don't know, Barack Obama or Einstein or Steve Jobs or whatever, but actually it was my father. He was such an unselfish, scrupulously honest, hardworking man, working in a culturally difficult area after the war. He joined the Royal Naval Volunteer Reserve when he was still only 20, and became a fleet air pilot and went through 5 years of the war and gave up his education, university education. And yet he managed to get his family through to be educated. I think it was also very generous to people who are less fortunate than himself, and almost to a fault. So I think that we're all we're all a product of our upbringing, and I think that he was a very good role model in my view. But from 2011 onwards, it was Gary Yeager, Professor Gary Yeager in New South Wales in Australia, who wrote, he's now written 3 textbooks of lifestyle medicine. And we became friends back in the time when I was setting up a lifestyle medicine centre. And he encouraged me, in fact, in the process, and encouraged me also to set up the British Society of Lifestyle Medicine. He always maintained that, being early adopters, as he saw it, of lifestyle medicine, that we would both become roadkill. And I hope he might be right. I hope the rush to lifestyle medicine is beginning. You'll end up as roadkill.
I think you are right. There's so many people. At the conference last year, there was huge numbers, which is great. I think the inspiration for your dad has in many ways become your message, the power of education to improve physical activity at both school age group and far beyond, and the role that we as primary care practitioners have in that is vital. And then also your pledge to be generous with energy and effort to inspire and help others to make the changes that they need to. So that's cool. I think that's a cool place to finish, actually. Those 2 points.
Well, thank you very much, Callum. I like that. I am watching what you're doing in Aberfeldy, and it reminds me of one of our members is doing something similar in the Netherlands, and in their town village, and there is mileage in that. There's good work being done, and yes, if you get, it's a bit like in working life. you make a difference with one person, and you draw in the family. It's like throwing a pebble in a pool, and more people get drawn into it. And the same with the work you're doing at Aberfeldy. It may be Perth will turn around and think, wait a minute, what are Aberfeldy doing? We want to do that as well. So keep up the good work.
Thanks, Rob. Yeah, I was going to mention at the start, but I decided not to. But for listeners, I've tried to set up as a community group that we're trying to inspire healthy living in our town, and with a tagline of becoming Scotland's healthiest town. And a lot of that has come from Rob. Is so much of the public health messaging we felt was quite negative. It's Scotland's the sick man of Europe, or the drug death capital, all these things. And we thought, it'd be so great to have an inspiring message, because I think we're all competitive to some degree, and it'd be nice if other towns in Scotland and the UK kind of raced us to the top. So yeah, thank you.
Absolutely. No, I'm with you. I'm with you. That's for sure.
Well, is there anything else you'd like to say, Rob? Anything else that any other comments?
Or no, all I would say to listeners is, that there are these 6 domains. There are social, economic, environmental factors, behavioral science. All of these things are a very, very important part of lifestyle medicine, and there must be something in there that really captures your imagination. Grab it and then use it, and you'll make that difference that we all want to make when we go into the healthcare industry.
Oh, well, Luke, thank you so much for joining us. You've been inspiring as ever, and hopefully we can continue the conversation another time.
Indeed. You're very welcome, Callum. Lovely speaking to you. Thank you very much.
Thanks, Rob. I really hope you enjoyed listening to this inspiring podcast with Rob. And forgive me for mispronouncing semaglutide correctly earlier on. When my interest first started in lifestyle medicine and physical activity, it was people like Rob, Hussein and Susie that inspired me. I still suffer from imposter syndrome, and this podcast is often an example of that. But hopefully you, like me, will be inspired by Rob and ultimately his simple message, which is to try things. So please engage with us on social media, share the podcast, and reach out if you have any questions or want to be on the podcast in future episodes. Thanks for listening.